A warm welcome to the Online Medical Advice, your one-stop destination for all your health queries. Remember to like, share, and subscribe to our channel to stay updated with our latest content. Today, we're going to talk about a common issue that affects millions of people around the globe: hair loss. From environmental factors to genetics, there are numerous reasons why someone might experience this condition. In this video, we aim to simplify the causes of hair loss and discuss some treatment options. Hair loss is more than just an aesthetic issue. It can have psychological impacts too. To understand hair loss, it's crucial to first grasp the natural hair growth cycle. Each strand of hair on our heads is in a stage of this cycle, which includes growth, rest, and shedding. The first phase, known as anagen, is the growth phase. Hair can grow about half an inch per month, and this phase can last anywhere from 2 to 7 years. Next comes the catagen phase, a short transitional period lasting about 10 days. The final phase, telogen, is the resting phase, where the hair remains in the follicle until it's pushed out by new growth. Now, disruptions in this cycle can lead to hair loss. For example, if the growth phase becomes significantly shorter, hair may not grow past a certain length before falling out. On the other hand, if the resting phase extends, more hair than usual may remain in the follicle, leading to a general thinning of hair. There are different types of hair loss, each with its unique characteristics. Androgenetic alopecia, often referred to as male or female pattern baldness, is the most common. It's characterized by a gradual thinning of hair, typically along the top of the head. Alopecia areata is an autoimmune disorder that leads to patchy hair loss. Telogen effluvium is a temporary type of hair loss often associated with stress, where a large number of hairs enter the resting phase at the same time, leading to significant shedding. Then there's traction alopecia, typically caused by hairstyles that pull tightly on the hair, damaging the follicles over time. Lastly, cicatricial or scarring alopecia is a rare type of hair loss where inflammation destroys hair follicles, leading to permanent hair loss. Understanding the type of hair loss you're experiencing can be the first step towards managing it effectively. Remember, hair loss isn't just about vanity, it's about your overall health and well-being too. Hair loss can be triggered by a myriad of factors. Let's delve into some of the most common causes, shall we? First up, we have genetic predisposition. This is the most common cause of hair loss and is often referred to as male or female pattern baldness. It's a natural part of aging, and it's all down to your genes. If your parents or grandparents experienced hair loss, there's a chance you might too. Next, we have hormones. Hormonal changes can cause temporary or permanent hair loss. This can be due to pregnancy, childbirth, menopause, or even thyroid problems. In these instances, the hair loss is often spread evenly across the scalp, which is different from the pattern baldness we just discussed. Stress, both physical and emotional, can also lead to hair loss. This is because stress can push hair follicles into a resting phase, meaning they won't produce new hair strands as efficiently. The good news? This type of hair loss is typically temporary. Diet is another factor to consider. Hair needs nutrients to grow, and if you're not getting enough vitamins and minerals in your diet, you might notice your hair thinning or falling out. This includes nutrients like iron, vitamin D, and protein. Lastly, certain medical conditions can lead to hair loss. This includes conditions like alopecia areata, where the immune system attacks hair follicles, or scalp infections. Certain medications can also cause hair loss as a side effect. It's important to note that everyone is different, and what causes hair loss in one person might not be the same for another. This is why understanding the cause of your hair loss is so important. It can help you and your healthcare provider choose the right treatment strategy, whether that's medication, lifestyle changes, or even surgical options. In conclusion, there's no one-size-fits-all answer to why we lose our hair. It can be due to age, hormones, stress, diet, medical conditions, and more. But remember, identifying the root cause of your hair loss is crucial in finding the right solution. While hair loss can seem daunting, there are several treatment options available. Let's dive right into it. The first and most common approach to treating hair loss is medication. Over-the-counter drugs like minoxidil, more commonly known as Rogaine, can help slow hair loss and foster new growth in some individuals. Prescription medications like finasteride, also known as Propecia, can also be beneficial, particularly in men. However, it's important to note that these medications don't work for everyone and can have side effects. Always consult with a healthcare professional before starting any new medication. Now let's talk about lifestyle changes. Yes, how you live can affect your hair. Eating a balanced diet rich in vitamins, especially B, C, D, and E, can promote healthy hair growth. Regular exercise can also improve blood circulation, which in turn can stimulate hair follicles. Reducing stress through practices like yoga or meditation can also help, as stress is a significant contributor to hair loss. If medication and lifestyle changes are not effective, surgical procedures may be considered. Hair transplantation, for example, involves taking hair from a denser area of the scalp and transplanting it to a thinning or bald area. This procedure can be quite effective but also comes with risks and a hefty price tag. Scalp micropigmentation is another option. This is a non-surgical process that uses detailed microneedles to deposit pigment into the scalp. It creates the appearance of tiny hair follicles to restore the look of a fuller head of hair. Lastly, low-level laser therapy is a relatively new treatment option. It uses light energy to stimulate hair growth, and while it's still being studied, early results are promising. Remember, each of these treatments has its pros and cons, and what works for one person might not work for another. It's crucial to consult with a healthcare professional to discuss these options and decide which is best for your unique situation. Remember, what works for one person may not work for another. It's about finding what works best for you. Prevention is better than cure, and this holds true for hair loss as well. As we delve into the world of hair care, let's remember that our choices can greatly influence our hair's health. What we consume plays a significant role. A balanced diet rich in vitamins, minerals, and proteins supports the health of our hair. Foods like spinach, eggs, berries, fish, and nuts are your hair's best friends, providing essential nutrients that keep your hair strong and shiny. But what's on your plate is just one part of the equation. Regular exercise is another crucial component. By boosting circulation, it supplies more oxygen to your scalp, promoting hair growth. So, whether it's a brisk walk, a yoga session, or a quick workout, make sure to get moving. External factors matter too. High heat and chemical treatments can damage your hair, leading to breakage and loss. So, next time you reach for that hair straightener or dye, think twice. Opt for natural styling methods and gentler products instead. Stress can also contribute to hair loss. So remember to take time out for relaxation and self-care. Deep breaths, meditation, or a good book can work wonders. A good night's sleep is essential too. Your hair, like the rest of your body, repairs and regenerates itself while you sleep, so ensure you're getting those much-needed 8 hours. Taking care of your hair now can help prevent hair loss in the future. Let's make choices that support our hair's health and keep it looking its best. Hair loss is a complex issue with various causes and treatments. Throughout this video, we have aimed to shed some light on the intricate realities of this concern. We've explored the mechanics of hair loss, delving into the myriad reasons one might experience it. We've underscored how everything from genetics to stress, health issues, and even environmental factors can play a role. We also ventured into the realm of treatment, discussing the range of options available. From medication to surgical procedures and even natural remedies, we've highlighted the importance of seeking professional advice to identify the most suitable approach for each individual. But let's not forget prevention. Ensuring proper hair care, maintaining a balanced diet, and managing stress can go a long way in promoting hair health. Remember, hair loss is a common issue, and you're not alone. We hope this video has been helpful. Stay healthy and keep shining.